Okay, we are live now, sir. Should we start?
Yeah.
Okay. Good evening and welcome to all the doctors. This is Ankana, the assigned moderator from IGCP group. I wholeheartedly welcome all the delegates across the country. We are fortunate enough to get supported by the doctors. Thank you all the doctors for taking out time to join us today. Now, I am taking this opportunity to welcome today's master doctor, none other than the eminent speaker, Professor Dr. Suresh Kishan Rao, sir. Sir is a family physician, public health consultant, Bangalore, and visiting professor of KSRDRU, Garam, Karnataka. Now, with the help of Dr. Suresh sir and his wonderful insights, we will be taking a close look on today's topic, which is ensuring safety and managing health of the elderly in hot climate. Without any further delay, sir, I would like to hand over the session to you. Kindly proceed. Over to you.
Thank you, Ankana. Dear friends, as already introduced, my name is Suresh. I am a family physician and mostly public health consultant, having worked for UNICEF for a long year and Government of Karnataka. This is my 56th year of medical practice and public health life. Opportunistic requirement of looking at the weather which we are going through in the recent weeks. This issue has been picked up by IJCPI timely. As you can see in the picture, we are more concentrating on the hot weather safety for senior citizens and management of heat-related illnesses in smaller settings, which means general practitioner, primary healthcare doctors. Very often it is the individual and the family that can play a bigger role, and very rarely these require medical attention. But having said that, hot weather does not necessarily mean only a natural hot weather as we're seeing, but there are other occupational issues. Having done my occupational health postgraduate diploma in addition to MD, we have come across these cases number of times. Therefore, the extreme left sentence clearly says extreme heat is particularly hard on older adults, and aging population and climate changes are putting even more people at risk. This is the nature of most of the cities and district headquarters in India in relation to the climate. We can see water clogging, which is very common whenever it rains. There are sinking Sundarbans, that is, forests are all going and they are sinking seashore. And there are also occasions of good green season and most often drought conditions. So what is the climate today? If you look at the climate today, there are two issues. One is India and another is Karnataka itself. Currently, the temperatures in the country in most of places are ranging around 35 to 47 degrees. In pockets of Telangana, interior Karnataka, coastal Andhra Pradesh, there is a lot of heat around 42 to 45 degrees. In Karnataka, the northern 8-10 districts or almost 12 districts are going through what is called as heat wave alerts. So therefore, this is the timely session to understand and be clear what, as a primary care physician, one will be called for and be able to do the needful. Now, what is the prediction? It says sweltering outlook for the entire month of May and partially in June in the northern part of the country. As you can see, most of the red zones in Karnataka, it is in northern and otherwise more northern districts. There are heat waves in the entire month of May 2024. When are these heat waves declared? Basically, heat wave is considered as a maximum temperature of weather station reaching at least 40 degrees centigrade. That is in the plain areas, and around 30 degrees or more in hilly regions. Based on the temperature which is departing from the normal, heat wave are cleared when there is a difference of 4.5 to 6.5 degrees Celsius from what was normal routinely. When the increase in temperature is more than 6.4 degree, we call this severe heat wave. Based only on the actual temperature, temperatures more than 45 degrees are called as severe heat waves. And if it goes beyond 47 degrees, it becomes severe heat wave. Today's temperature in various cities, you can see, are ranging from 32 to 42 degrees in Kolkata. In our own state, you can see the departure from the normal temperature in the previous year is about 4 degrees. What decides? It is just not the temperature, but also humidity. Whenever the humidity crosses 60%, the ability of the environment to pick up perspiration and heat, which we dissipate, becomes challenging, and then we start feeling. These are the temperature ranges expected in this month. Most of the temperatures are maximum temperature in Karnataka is about 38 to 40, but there are districts like northern district like Kalburgi, Raichur and all that, they have already crossed 42 degrees. So what happens if the climate is hot? How does human body react? Generally, we all know too much of heat is not safe for anybody. However, because we have to be cautious and get relief quickly when we are overheated. Extreme weather is more dangerous for older adults and younger infants. Most elderly start sick or get heat-related illness, which become serious enough. If a senior has other health problems like diabetes or hypertension, the risk will be much higher. Why? Because the hotter days cause difficulty in body's ability to regulate its own temperature. As already said, elderly adults are more likely to have chronic medical condition, and most of them are on some or the other drug prescription medicine, which adds challenge for the body's response to manage the heat stress. So what are the index we use for the heat-related condition? Heat stroke is strongly related to what we call as heat index, which is the measurement of temperature and when it affects relative humidity and air temperature combined together. As I already told, relative humidity of 60% or more hampers the sweat evaporation, which in turn hinders our body's ability to cool itself. The risk of heat-related illness dramatically increases when the heat index climbs to 90 degrees or more. Therefore, it is important to pay attention to the reported heat index and to remember that exposure to full sunshine, if you go into the hot sun, heat index will be increased by 15 degrees straight. Heat stroke is almost likely to affect older people who live in apartments or homes without air conditioners or good airflow. Of course, the much higher risk groups are people who are aged, who do not drink water, because generally senior citizens don't feel thirsty. They have chronic diseases, or people who are used to take alcohol in this summer are exposed the person for a higher risk. Now, this is the index, how it is worked out. You can see temperature is in Fahrenheit here and relative humidity percentage. So right starting when the Fahrenheit crosses 90, which is hardly around 38 degrees in Celsius, the risk starts. So the more the temperature, you can see if the chances of heat stroke, sunstroke increase. So let us understand what is the physiology of heat stress, what causes heat stress, what are the disorders and health effects, what is the workload assessment, and how do we control. Basically, looking at the physiology of heat stress management in our body, at body is at rest, our temperatures are in the range of 98.6 degrees, and the blood volume is normal. This happens both during rest and activity, as the human body tries to maintain an internal temperature of 98.6 degrees. Suppose you are in a hot weather for about an hour or two. Then again, do hard work, raise the body's core temperature. Heated blood is pumped to the skin surface where the body heat transfers to the environment and cools it. Transfer environment means going as a sweat, as an evaporation. If our body heat has to be shed faster, sweat carries it outside the skin and evaporates to the air to aid the body cooling ourselves. Still, we will be able to maintain normal blood volume, normal body temperature. Suppose the same exposure goes to 2 to 3 hours in the initial stage. If people are doing heavy work, as our farmers, industrial labor workers, the body can lose 1 or 2 liters of water within about 3 hours. Then what happens? After these 3 hours of the fluid loss, the person is likely to lose endurance. That means he cannot do the same job with same intensity. Starts becoming uncomfortable, feels hot, and becomes 30. What happens in this case? The temperatures go around 99 degrees or even 99.5. The blood volume increases moderately because of the warmth. If the person continues to work further beyond 3 hours, one might see that the blood volume increases a lot, very low volume because of the dehydration. Temperature reaches almost 100 degrees. Since the water is a cooling mechanism of human body, once there is dehydration, we start combating heat stress. If we do not replace the fluid lost for an extended period of 3 to 4 hours or beyond that, the body feels exhaustion. If you do not treat the person or yourself when heat exhaustion is noted, you may land up into what we call as a heat stroke. This is always seen heat cramps and heat exhaustion after about 4 to 6 hours. More if the person more he sweats, the less blood will be there to carry oxygen to the skin, and therefore the nutrients and excess heat is transferred to the skin. During this period, the blood volume goes very low, temperature reaches 100, and the person may feel mild headache, muscle fatigue quickly, loss of strength, loss of accuracy and dexterity, heat cramps, reduced alertness, and nausea. So these are the stages when one starts working in the hot sun or in front of furnaces or car mechanics, bike mechanics. So all those people who work in hot sun, after about 4 to 6, start feeling this discomfort. So what determines the heat response? We all know, basically it is age, weight. Heavier the person, they feel more stress of the heat. Similarly, the aged person, as we already told, and degree of physical fitness. People who are already doing exercise and physically fit, they are in a better position to tolerate heat, but those who do not go outside are very rarely doing any physical exercise, always find it difficult. Second issue comes in is what we call as a degree of acclimatization and metabolism. Here, each one of us takes some time to get adjusted to when the climate changes. That is known as acclimatization. Whether it is due to the height of the place you are or seashore, it will take time. So over some time, you get adjusted. For example, I was in Delhi for 30 years, where the temperature in the months of May and June will be in the range of 40 to 42. But now, having come to Bangalore for the last 6 years, this time, though the temperature is only 38, I am starting feeling, because I have not my acclimatization of Delhi climate. Our metabolism changes, you feel more thirsty, therefore the hunger goes down. If hunger goes down, you don't eat much, and the energy loss. People who use any drugs for hypertension, diabetes have more sensitivity to heat. Therefore, those who are diabetics, hypertensive, need to avoid getting into the hot sun to the extent possible. If it is not possible, you may have to take other precautionary measures. We'll come to that. The other important thing is type of clothing we wear in this season. Cotton is the best. Cotton and white color dresses are the best. They should be loose enough, no jeans, particularly tight jeans. And then if there is previous history of heat injury, then the individuals are more at a risk. They have to be more careful. Once you have a heat stress response shown once, every time later you have to be careful. What raises the risk of heat-related illness among the older adults? Health problems such as cardiovascular, lung and kidney diseases, changes in the skin due to normal aging, illness that causes weakness and results are a fever, people who are on drugs like diuretics, sedatives, tranquilizers, beta blockers for hypertension and heart, for them it becomes difficult to cool the body themselves. Multiple drug consumption confuses and again is an extra risk. I already have told you, having obesity or overweight, even underweight, are people are at a risk. Direct exposure to sun in the agricultural field or hard physical work in the industries and mechanics, alcohol drinking, living in places without air conditioning or fans, and getting dehydrated. Some of the common illnesses we will mention first and then try to take one after another. Commonest is what is called as the heat syncope, which is feeling sudden dizziness when people are active in hot weather. This particular condition is more common among the people who are on beta blockers for hypertension or do not drink water periodically, are exposed to the heat weather without acclimatization. Common thing people do and should do is resting in cool place, put the legs up and drink water to make the dizzy feeling go away. Next common is the heat cramps we see in the northern districts of Karnataka and northern states in summer, where there is painful spasm of muscles in our stomach, arms, and legs. Heat edema is a swelling of our feet at the ankle and feet level. Only by raising legs, the swelling can be reduced. If it does not reduce quickly, it is better to consult a doctor. Commonest another thing, prickly heat, we all have experienced as children in those who lived in northern Karnataka and northern states, experience and which are commonly seen in fair-looking people. This is a skin rash with irritation due to heavy sweating. There will be clusters of small blisters that look like pimples on the skin. Skin may feel itchy or there is a tingling pain. Now we can talk of some three serious conditions. Heat exhaustion is warming that our body can no longer keep cool itself. Here, one might feel thirsty, dizzy, weak, and uncoordinated or nauseated. The person may sweat a lot, but the body temperature stays normal. Please note, heat exhaustion, the body temperature is normal, but the skin will feel cold and clammy because it is perspiring. The pulse may be rapid in some people. Resting and taking fluid is the simple answer. We'll come to that in detail later. More severe situation is called heat stroke. This is a medical emergency where doctors will be called in. The clear indication here is the body temperature is more than 104, that is 40 degrees Celsius, or even higher. It is always useful to take the rectal temperature, not the oral, because the person may be unconscious. Usually the individual is confused, keeps acting strangely. Sweating has stopped already. The skin is dry, flushed or hot, rapid pulse, and it is weak also. The worst thing that can happen of heat stress is what is called as a sun exposure or sunburn, is a sign of skin damage due to extreme or long time exposure where the skin appears red, tender, develop blisters, starts to peel, and it will be warm to touch. The person will have severe reactions like fever, chill, nausea. Now we'll look one after another condition. These are the visuals of the common condition. Heat cramps, you can see people holding their calf suddenly and feeling not able to lift, put hand. Heat rashes or prickly heat, feet edema, and heat syncope, that is elderly people suddenly falling down. Now let's look at each of these things and what can be done. Heat exhaustion, you can see the person sitting holding his hand, though the entire area is green, the sun is so high that the person has headache, nausea, vertigo as is feeling giddy, weakness, thirsty, and what are the concerns? One should not miss these signs and dismiss lightly if you are called for. Because fainting is associated with his exhaustion, can become dangerous, particularly in the people who are working in an operating machinery or controlling an operation. Victim gets injured if he or she falls in a dangerous place. So what if they are already not done? As a primary care physician, you need to see that the person is removed to a cool environment, if nothing else, under the tree, and given fluid to replace. They should be made to take rest for next hour or two. Cramps, this is more common on people, athletes who run the races in summer, particularly in the afternoon sessions. As it says, it is caused by performing hard physical labor in hot environment. Physical labor could be working in the farm, could be athletics, could be working hot furnace, or vehicle mechanics working under heavy vehicles like trucks, etc. The cramps are attributed to an electrolyte imbalance caused by sweating. You know, when you sweat, you lose sodium and potassium. That is the reason why the cramps occur. They can also be caused by too much and too little of salt consumption by the individual. Thirst cannot be relied as a guide for needing water or salts. Therefore, people who are in such occupation or athletes must be made to take fluids of about a glass or two every 15 to 20 minutes, whether they feel thirsty or not. So these are happening under extreme condition, working for 6 to 8 hours in heavy protective gear. For example, firefighting people. They have a protective gear, but they have to work, and some of them may lose perspiration, sodium. Recent studies have shown that the drinking commercially available carbohydrate electrolyte replacement liquid is more effective in minimizing the physiological disturbance during recovery. Therefore, any commercially available carbohydrate and electrolyte fluids should be given. Heat collapse, which is fainting, occurs again among the elderly, more common, and people who are working in the hot climate like steel mills, athletes running long race in the sun. What happens? In heat collapse, the brain does not receive enough oxygen because blood pools in the extremities. The person is running, so blood goes to the feet and hands. Similarly, the worker is working, blood goes to heart and standing. So the worker or the runner must gradually become acclimatized to the hot environment. Should not start working suddenly throughout the entire course. Slowly should increase the workload and get used to it before doing full-time work. Prickly heat, we have seen more among the young children, prickly heat. All of us who are grown in northern Karnataka or northern state have experienced. While in the children, it is more common on the face, that is exposed because the rest of the body, the mother covers the baby. But among the elderly also, you can see the neck, forehead, where it is exposed, are the common site one sees the prickly heat. Prickly heat occurs in the skin that is persistently wetted by unevaporated sweat. The rashes or papules may become infected if they are not treated. These rashes will disappear if the person returns to the cool environment. If the symptoms persist or the rash seem to become infected, should seek medical care, and medical people should be able to analyze and treat. What one should do on themselves or the doctors when the case is, loose fitting cloths must be the natural fibers such as linen, cotton, hemp, etc. Remove the sweaty cloths after a long day of warm weather that prevents sweat from getting trapped. Taking a shower to wash off the sweat and changing into fresh clothing, and using talcum powder over the sweating area after cleaning. Heat fatigue usually seen in fatigue and athletes who run in long runs, races in the hot sun. This is due to lack of acclimatization. The signs and symptoms include impaired performance of the skilled sensor, motor, mental, and vigilance jobs. Signs include impaired performance. So what can do? The 5 major types of controlling are done from an engineering point of view. One is better ventilation of the area. Second is cooling the air. Third is using fans where you work, like kitchen, etc. Women working in the afternoon should be exposed to fan. Shielding the area from furnace and insulation of the area to limit the external temperature. These are the common sites of rashes which occur in the elderly people. And you can see the occupations, like the person who does ironing using the traditional coal iron in drop areas, they also see these sweaty areas and where heat, prickly heat can occur both in men and women. Heat stroke is the worst of the conditions that happens. It is a condition where our body gets overheated due to prolonged exposure or physical exertion in high temperature, natural or furnaces or ironing people exposed to that hot iron throughout the day. The most serious form of heat injury is this heat stroke. If the body temperature rises to more than 40 degrees centigrade. One need to try to distinguish between heat exhaustion and heat stroke because the latter requires an urgent action, though they are continuum of heat-related illness. Both are common and preventable conditions. Research says that a cascade of inflammatory pathological events that begins with mild heat exhaustion and if uninterrupted can lead ultimately to multi-organ failure and death. Heat exhaustion is characterized by non-specific symptoms such as malaise, headache, and nausea, where the body temperature is normal, whereas untreated exhaust leads to heat stroke, which is much serious, where the central nervous system dysfunctions and person faces delirium or coma. Here we are trying to do visually the distinguishing factor. In heat exhaustion, the person is exposed and trying to manage himself. In heat stroke, the person has collapsed because his central nervous system has failed to work. How do you distinguish between exhaustion and stroke? Person is fainting in exhaustion or he is dizzy. That means he might feel like falling. Whereas in heat stroke, the person has a throbbing headache first. In exhaustion, there is an excessive heating, whereas in heat stroke, sweating has stopped. There is no more sweating. The skin of the person who is under exhaustion is cool, pale, and clammy skin, whereas the person who is under heat stroke, the body temperature is more than 103 degree Fahrenheit or about 39 degree centigrade. It is red, hot, and dry. The exhaustion, people may feel nausea or vomiting. This may be common both among stroke and exhaustion patient. This picture depicts same thing which I already told you, and the organs which are involved. For example, dizziness and fainting, headache and confusion are related to brain getting affected. Intense thirst is again a normal phenomenon in exhaustion, whereas the elevated body temperature is there in the heat stroke. There is excessive sweating and no sweating. In heat exhaustion, pulse is rapid, where it is rapid and strong. Here it is rapid and weak. Nausea and vomiting are common. The skin is pale, cold, clammy. Here it is red hot. In stroke, the person may lose consciousness. Here the muscle cramp and fatigue are seen. Who are risk of both exhaustion and stroke? Mostly elderly people, very young children, athletes, our armed forces people because they work in hot sand, and industrial worker, outdoor workers we generally call, building and construction, roof layers, etc. The risk factors have already been summarized. Not drinking enough of water, chronic diseases, excessive alcohol consumption, and of course, heat stroke is related to heat index, as we already said. And this slide you already seen, which shows how the combination of temperature and relative humidity creates the problem. If the external temperature is 110 and humidity is less, you still can manage. But if both go haywire, the dark brown areas are the high risk situations. In terms of occupation, this is common in Indian rural India. Shepherds who go for grazing either animals or sheep, and those who are working in the agricultural field. In the cities, it is more of hard-working people, construction workers, mechanics. There is no surprise nowadays. We have also women car mechanics who work, and they are more delicate to manage heat stress. So these are all people at high risk. If anybody coming with this occupation, you need to be doubly careful. We already read through the signs and symptoms. How do you diagnose? If the patient is brought to you, you better take rectal temperature to know the core body temperature. This is most accurate of determining the body temperature. Sometimes blood test may be required to look at the sodium and potassium levels. Anyway, urine test is dark urine indicates the dehydration, as we all know. And any other kidney function test will also indicate complication, if any. Muscle function tests are required if person has muscle tissue problem, which are called as rhabdomyolysis. X-rays and other imaging tests are very required unless there is a suspected internal organ damage. Now we look at the management as the primary care workers. First, we look at first aid, which can be given by anybody who is nearer the individual. What they must do is move the patient or the affected person to a cooler environment, even under a tree or any protected. Second, elevate the foot so that the blood drains to the heart side, and reduce the clothing. If the power is, for example, a fireman, if you see a fireman or a worker with personal protectives, remove them, loosen the dress, and start cooling the body by using a fan in front of him, putting a wet cloth, or even sponging with the wet, using oscillating fans to increase the convective heat loss. Suppose you as a doctor are there, it's a medical emergency in case of heat stroke. One must attempt, the basic principle here is to reduce the core body temperature. Because the duration of hyperthermia, that is what we already said, is more than 38 degrees, is the primary determinant of the outcome. The patients may have what is called an external heat stroke, EHS, or non-external heat stroke. These are the industrial workers working in front of furnaces and mechanics, etc. They should be admitted to the hospital for at least 48 hours to monitor the complication and manage. Once the heat stroke is suspected, cooling must begin immediately, even before you think of transporting along with resuscitation. What does nursing care involve? As I told you, nursing care does not necessarily mean a qualified nurse need to be there. Basically, looking at the body temperature, monitor the heart rate, blood pressure, and rectal temperature if possible. Immerse the person in cold water or bathe the person in cold water so that there is a quick lowering of the body temperature. Use other evaporation cooling techniques. We already said, put the patient in front of fan, cooling blankets, put the cooling blankets. Actually, I can recall my summer days in the initial years of my primary health postings in a district known as Gulbarga in the northern Karnataka, where the temperature used to shoot between 40 and 42 in the afternoon. We used to wet a towel and put on our bare body and sleep under a fan. Blow a fan air over the patient while wetting their skin with water from sponge or a garden hose. This is a new thing. Some of you might have seen a recent WhatsApp message where it says India needs following service. Just like fire station, there are stations where people are standing with a garden hose pipe. They put water on the person coming there and they move on in the hot sun. Applying ice packs to the patient's armpit, groin, neck, and back, because these are the areas where the blood vessels are close to skin and it will easily reduce temperature. Immerse the patient's legs in water, cool water, or let him have a shower. If person is shivering, you can give some anti-shivering drugs like chlorpromazine or sedatives. Identify what are the triggering factors, address them. Review the electrolyte imbalance if the person continues to be unconscious. Start intravenous normal saline solution and provide a high caloric diet. Discuss and convince the family for an increased fluid intake to avoid dehydration. The non-physician or nursing diagnosis is based on hyperthermia, dehydration or low pulse, nausea, anxiety, acute confusion. Now, As a medical doctor, you must be prepared to go beyond what the first aid person does. You are called in for basically to manage either heat stroke or heat exhaustion, and children may be brought with prickly heat. Here, it is one of the leading cause of preventable death in sports. Intensive sports, cricket in the afternoon, football in the afternoon, any outdoor game for that matter. So what happens is rapid reduction of the body temperature is the cornerstone of the treatment, as we are told, as the duration of hyperthermia is the primary determinant of outcome. Once the heat stroke is suspected, I have already told, cooling must begin immediately, even before thinking of transporting, along with continued resuscitation. This is what the sports meditation recommends. Monitor the patient in a cool, shady environment and ensuring adequate hydration. Because it is an emergency, start giving IV fluids, cover with wet blanket, manage hypothermia. As I told you, these people must be monitored for next 48 hours. Monitor the electrolyte balance. Sometimes, if the temperature too high, you can think of even irrigating the stomach and lower bowels with cool solutions. People are using medications, but there is not much of evidence that any medication is likely to help in treating heat stroke. Muscle relaxants like benzodiazepine and neuroepileptic agents such as chlorpromazines have been used to inhibit the shivering and as a prophylaxis against seizures, but clinical trials are lacking to prove its efficacy. A drug known as denitrium is used to prevent and treat and reduce the risk of malignant hyperthermia, that is a fast rise in body temperature and due to muscle contraction. This is a class of medication called skeletal muscle relaxant. Again, its efficiency in heat stroke is doubted. Not enough evidence is there. So whether it is denitrium or antipyretics have no role in treating heat stroke. As I told you, cooling is the basic principle and it can be discontinued once the core temperature reaches 38 degrees centigrade, and keep watching. What are the possible complications? Severe complication, if there is no quick response to lower the body temperature, include vital organ damages like brain, or there is a swelling of the internal organ resulting in permanent damage. Death occurs if there is no prompt treatment of heat stroke. Can we prevent heat stroke? When the heat index is high, the best way is to stay in the air-conditioned environment. If people have to go outdoors, they need to wear lightweight clothes, light-colored, loose-fitting, and wide-brimmed hat. Use a sunscreen with a sun protection factor of 30 or more. Drink frequently fluid. How frequently? If person is going in hot sun or doing exercise, what they should do is drink 8 glasses of water, which is almost about 1 liter of water, 2 hours before the actual day or the beginning of the day. It causes salt depression. Substitute of an electrolyte-rich sports drink is also advocated. Additional precautions when exercising or outdoor work or working in the factories which generate heat is, one should look for 1.5 liter water 2 hours before. That is in 1.5 liters in or out of which half of that should be drunk 2 hours before the exercise and consume about 8 ounces, which makes about 1 glass of water or sports drink before you start exercise and every 20 minutes thereafter, even if one does not feel thirsty. If possible, reschedule or cancel the outdoor activity. For those who are doing exercise and all that, try to see if you can shift your outdoor activities to cooling timings of early mornings or late evenings. In the industrial setup, having come from the industrial health background, there are efforts being made to these 4 activities are done. General ventilation to dilute the hot weight with cooler air. Cooler air is brought from outside. There is an internal cool reducing possible by what is called as air treatment or air cooling. And this is again reducing some humidity component also. As I told you, it is temperature and humidity which together matter for heat stress. Air condition, of course, is the best method, but we can't think of this in every working place like furnaces, etc. It's not only difficult, but it is to install, but also to operate in such a hot environment. Local air cooling is effective in reducing the air temperature in specific areas. The Factories Act, Indian Factories Act, issues what is called as administrative control on work practices. That is making the workers aware of the hazards of heat stress, recognizing the predisposing factors which we are and danger signs and symptoms which are already elicited, awareness of first aid procedures for and the potential health effects, empower employee responsibility in avoiding heat stress. They must be told that it is their primary responsibility. And the employees must use protective clothing given and use the equipment. One also need to create awareness about the dangers of using drugs, particularly alcohol and therapeutic drugs, and to handle that, frequent hydration. Coverage of environmental and medical surveillance programs in the factories is mandatory. And there is a need and urgency and advantage of worker participation. All these programs can minimize the heat stress action. Finally, I end with a summary. Scorching temperature have put millions of Indians in danger this summer, with heat extremes stretching from northern states to southern states and even in hilly resorts. In fact, I was recently in Srinagar. The temperatures are already working there. Temperatures of 43 degree more are more dangerous. And the common methods is wear light, loose clothing, acclimatize to hot conditions slowly, avoid exercise during the hot part of the day, and stay well hydrated. Hot and humid conditions are reported over coastal Karnataka, while severe warm conditions will be prevailing in Orissa in the next entire month. The highest temperature we have reached in the country is already 47 degrees and 41 degrees in Jharkhand and West Bengal. Karnataka and northern districts particularly are likely to get exposed to around 45 in the next few weeks. What ultimately helps is individual precautionary measures and efforts of the workplace and community scale adaptations and management by the primary healthcare worker are the urgent need of the time. With this, I conclude the session and open the session for questions, if any. This picture shows the alarming sign, take care of guys. Earth is on fire. Across, you can see the brown or dark red colors. Finally, in a humorous poster I found, people are asking for the sun to reduce his brightness, and the sun in turn says, sorry, I can't do much. You better increase the number of trees, reduce the carbon emissions, reduce concrete jungles, increase the number of lakes. Thank you. And now it's open for queries, if any. Thank you, Priyank. Ankana?
Thank you so much, sir. And sir, we do have some question if you like to take that up.
Please shoot.
Thank you, sir. So, sir, the first question is, what modifications can be made to the living environment of elderly patient to help them stay safe and comfortable during hot weather?
We have to look at the three situations of the elderly. Number one, those who can afford keeping them in air condition is the best option. At least in the afternoon, that is starting from 10 o'clock in the morning till 4 o'clock in the evening. But we all know air conditioning is not an affordable option for majority of the Indians. What comes next is using fans in the rooms they are, and probably, if required, covering with wet cloths now and then in the afternoon. The other situation is the working environment. Though the senior citizen is defined as 60 years plus, some people who are about 45, 50 and working in hard labor, like industrial setups, like our farmers, mechanics, both of these don't work. What they need to do is try to hydrate themselves periodically, take shelter under shadow of trees or whatever sun available, and if they are walking, use an umbrella to protect, if not a hat with a wide breadth, so that there is no direct sun on their face. So these are simple factors. Depending upon the individual you come across, you need to advocate. I cannot advocate an air condition for a farmer or a person working in front of a furnace. Next question.
Sir, the next question is, how do common medication used by elderly impact their ability to tolerate heat, and what adjustment may be necessary during hot weather?
So as I went through the physiopathology, I told heat weather, what it does is, because we sweat, dehydration occurs and the blood volume becomes concentrated. That is, dehydration occurs. Now, people who are already having conditions like hypertension, diabetes, or any cardiac disease or kidney disease are at a risk of getting dehydrated much faster. So, if they do not keep consuming, that is why throughout the session I was telling, thirst should not be taken as an indicator of dehydration among elderly particularly. They should be made compulsorily to drink fluid every 2 hours if they are under shelter. If they are exposed and under hot sun like farmers, they must be made to drink water of 1 glass every 20 to 30 minutes, and whenever possible, take shelter under the shadow of trees. The drug need to be seen, and if the dose requirement need to be adjusted based on the reaction of the individual, the physician must adjust the works of antidiabetic, diuretics, and beta blockers.
Thank you, sir. We have one last question.
Yeah.
So, what are the potential long-term health effects of repeated heat exposure in elderly individuals, and how can they be mitigated?
Long-term effects, I told you, are basically our existing condition worsen. We all know most elderly globally and even in India have some or the other condition for which they are taking some drugs. And we also know that in India, an individual who is 60 years and more, majority of them are taking at least 3 drugs at a time for various reasons. So therefore, what long-term effect is the worsening of the existing condition. And as I told you, if there is a dehydration, the internal organ gets swollen and slowly get what we call as organ dysfunction. And finally, it may be fatal also. So therefore, if the person is known to be sensitive to heat stress, better to avoid working in those climate, find some alternatives. And when it is essential to go out, get personal protection like using umbrella, hat, minimum cloth dressing, rehydration, etc. I am done.
Thank you, sir. Thank you for answering all our questions, sir. So, before concluding, sir, any last remark from you?
Last remark, I am just asking people to look at this. Sun is hot. That is not going to change its setting. If at all, settings will worsen. So we as individuals need to make an effort to protect ourselves by personal thing. Organizations like factories need to give the workers enough hydration, etc. And then as a society, in the years to come, we need to address these 4 issues of increasing the number of trees, reducing the carbon emission by use of vehicles, reducing the concrete jungles, particularly in the cities. I can recall Bangalore city when I first visited in 1958, and today the concrete jungle has increased 100-fold. We hardly see anything. So the construction of multi-story building, etc., reducing the subsoil water, which would have absorbed some heat, and lakes have dried out. Bangalore and most of the cities claim that nearly more than half of their natural and human-made lakes are dry now. Therefore, basically, we need to switch to more of a human mode from an auto mode, which we all are there. The attitude of what if I am in air condition, that is enough, should go. As a community, we need to make the environment more human friendly. Thank you.
Thank you so much, sir. And with your permission, I would like to conclude today's session. Thank you.
Thank you to all our friends and you.